This is 41 Today on 41 NBC.
Welcome back. February is American Heart Month, a time to focus on heart health and the steps that we can take to prevent heart disease, which remains the leading cause of death right here in the United States. And joining us today in studio is Dr. Jonathan Brock, a staff electrophysiologist with Central Georgia Heart and Vein Center. He specializes in diagnosing and treating heart rhythm disorders and is here to help us better understand how to protect our hearts and recognize warning signs early. Dr. Brock, thank you so much for being here. How are you?
Thank you for having me.
Of course. Thank you. So let's talk about this, right? Heart disease affects millions of Americans every year. Can you tell us what are some of the most common heart conditions that you see and what puts people most at risk?
So being a heart rhythm disorder physician, I deal mostly with those things. So I deal with atrial fibrillation is the most common abnormal heart rhythm that I deal with. I also deal with slow heart rhythms. But being trained as a general cardiologist, we see a lot of those folks as well. So that includes coronary disease. So when we think about heart attacks, that's what we're talking about. We also deal with hypertension, so elevated blood pressures as well. So that would probably be the most common things that we see.
Okay. And then many people don't realize that there are early warning signs before a serious heart event happens. So can you tell us what are some of those symptoms that the viewer shouldn't ignore?
So chest pain is the thing we commonly think about, but I would say subtle symptoms such as being more fatigued or even short of breath, that's a big one that I look for. Those things could be early warning signs that we don't like to ignore and we think probably needs additional workup.
Got you. And then earlier I noticed you were talking about hypertension, blood pressure. So can you tell us what is a good normal blood pressure that we should be at or the numbers that we should not be above?
So it's somewhat individualized, but I would say most people we should target a goal of the top number, the systolic blood pressure being less than 130 and the bottom number being less than 90.
Got you. Okay. And if it's over that, then we need to see what we need to do about it.
Correct. Yes. Yeah.
Got you. And so some of those things that we could do are, I'm assuming, less salt intake, less fast food, less stress.
Yes, correct. Yeah. So, salt intake is a big thing. Even 10 pounds of weight loss can have a big impact in lowering your blood pressure. And if you need to be on medications, following a plan with your provider and making sure you're adherent to those medications and those goal blood pressures that they set for you.
Got you. Okay. And then you specialize in heart rhythm problems. So can you explain what irregular heartbeats are and when they become dangerous?
Yeah, so there's a lot of different irregular heartbeats. So folks experience those different. They could even say they have shortness of breath. They could feel those classic palpitations. Their heart skipping a beat is the big thing that I hear. So those can be indicative of a lot of different things. You could have just one early skip beat and be symptomatic. You could have your heart out of rhythm 100% of the time, never feel anything, or you may experience some of those same symptoms. So it's really important that if you do have those symptoms, that you get checked out, we evaluate you and make sure nothing serious is going on.
Wow, yes, definitely important. I know a lot of people, sometimes people will wait for issues to prolong, but it's important once you notice something, you got to say something.
Absolutely,
go get checked.
yes,
So
absolutely.
Definitely a good tip there. And then for the people watching at home, what are some of the most important daily habits that can significantly improve heart health and lower the risk of heart disease?
Yeah, so in general, I think just being active. So the American Heart Association recommends you have moderate exercise of 150 minutes per week or vigorous exercise of 75 minutes. But anything is better than nothing. So I think if you can be active and just work, every day getting a little bit better and doing a little bit every day.
Okay, sounds good. And then last but not least, how often should adults get heart checkups and screenings?
I think at least annually. It's somewhat based on your risk factors and what medical conditions you've been diagnosed with, but I would say at least annually, so at least once a year.
Okay, sounds good. Well, Dr. Brock, we definitely appreciate you for coming and sharing your insight. And guys, American Heart Month is a reminder that small lifestyle changes and early detection can help save lives. Dr. Brock says knowing your risk factors, paying attention to symptoms, and making sure that you're choosing heart healthy choices can make a major difference